Thank you for joining me with the slide presentation today on NP thyroid. And we're going to be starting with understanding the options for management of hypothyroidism. My name is Dr. Gary Pepper, and I'm a full-time clinician at Palm Beach Diabetes and Endocrine Specialists, and I'm board certified in internal medicine and endocrinology. I am a paid speaker, and I'm speaking on behalf of Acella Pharmaceuticals. Acella is the sponsor of this program and event, and the slide deck and program itself is developed by Acella Pharmaceuticals. And because of this, there is no CME credit, which will be offered today. We're going to start off with the diagnosis of thyroid disease and review briefly therapeutic options. Then we're going to talk about the focus of our lecture today, NP thyroid, which is a desiccated thyroid extract. We're going to talk about the typical patient profile of a person who could benefit the most from this unique product. And we're also going to talk about how to dose desiccated thyroid extract and how it is compared to levothyroxine. And at the end, we'll show you some resources that are available through the company for your office and for your patients. Here's some important risk information. Indications and important risk information. Indications. NP thyroid is a prescription medicine used to treat a condition called hypothyroidism from any cause, except for cases of temporary hypothyroidism, which is usually associated with an inflammation of the thyroid known as thyroiditis. It is meant to replace or supplement a hormone that is usually made by your thyroid gland. NP thyroid is also used in the treatment and prevention of normal functioning thyroid goiters, such as thyroid nodules, Hashimoto's thyroiditis, multinodular goiter, and in the management of thyroid cancer. Warning, drugs with thyroid hormone activity alone or together with other therapeutic agents have been used for the treatment of obesity. In euthyroid patients, doses within the range of daily hormonal requirements are ineffective for weight reduction. Larger doses may produce serious or even life-threatening manifestations of toxicity, particularly when given in association with sympathomimetic amines, such as those used for their anorectic effects. Important risk information. Thyroid hormones, including NP thyroid, should not be used either alone or in combination with other drugs for the treatment of obesity or weight loss. In patients with some normal thyroid levels, doses of NP thyroid used daily for hormone replacement are not helpful for weight loss. Larger doses may result in serious or even life-threatening events, especially when used in combination with certain other drugs used to reduce appetite. This is not meant to be an exhaustive discussion of diagnosis and treatment of hypothyroidism, but we're just going to review the basics so that we're all on the same page while we go through the material. This is a slide you should be familiar with. The thyroid pituitary axis actually begins in the hypothalamus, which releases TRH into the pituitary gland, which then releases TSH into the peripheral blood, which circulates to the thyroid, which is then induced to create T4 and T3, which enters the peripheral blood again and out to the peripheral tissues, including central nervous system, musculoskeletal system, cardiac, gastrointestinal, etc. And this is where things get really interesting because in the peripheral tissue, T4 is converted into the more biologically active T3, and the T3 then goes into the cells where it creates its metabolic effect. The etiologies of hypothyroidism are multitude and can sometimes be tricky to diagnose because the symptoms of hypothyroidism are generally nonspecific and could be due to many different causes. The most common cause of an underactive thyroid, though, in the United States would be Hashimoto's thyroiditis. Other causes I would call endogenous, which is hypothyroidism that develops in adulthood, but the anti-thyroid antibody panel is negative after radioactive iodine treatment for hyperthyroidism. after the thyroid is removed for thyroid cancer, after certain viral infections can cause subacute thyroiditis. Those are those essential major risk factors. Symptoms of hypothyroidism are somewhat general, such as fatigue, weight gain, puffiness, diminished mental acuity, constipation, muscle cramps. And for that reason, hypothyroidism, as mentioned, can go unrecognized because of the vagueness, you might say, of the typical symptoms. Well, how do we diagnose hypothyroidism? Actually, once you think of it, it's not very hard. Most people with Hashimoto's thyroiditis, for example, have an enlarged thyroid, which can be palpated. Thyroid function tests are extremely accurate and sensitive, and those include TSH, free T4, free T3, and the antithyroid antibodies, which are fairly specific for autoimmune thyroid disease. Now, what exactly is desiccated thyroid extract? In the present literature, it's now being considered combination therapy. Combination meaning it combines both T4 and T3. You can take thyroxine and add synthetic T3 to it, and that would be combination therapy. On the other hand, in a single tablet of desiccated thyroid extract, you will get T4 and T3 also, which for many people is a great convenience. The ratio of T4 to T3 in the desiccated thyroid extract is 4:1, which is significantly more than in a normal thyroid, though the exact ratio of T4 to T3 in normal thyroid is subject to question. And in the treatment of hypothyroidism, particularly relevant to our discussion today, is the fact that a substantial portion, anywhere from 10% up to 15% of individuals continue to complain of the symptoms of hypothyroidism, despite the fact that the thyroid function tests, TSH, T4, et cetera, are in the normal range. Recent studies are focusing on genetic variations, which may be responsible for this. There is a particular mutation in the enzyme D2 deiodinase, which converts T4 to T3 both in the central nervous system and in the peripheral tissues, a defect that results in inefficiency of the conversion of T4 to T3. Therefore, even with what appears to be a normal amount of T4 in the blood, these individuals remain deficient in T3 and continue to have symptoms of hypothyroidism. And the solution is fairly straightforward. By giving individuals in that category T3, you get around that roadblock and are able to normalize intra-tissue levels of T3 using either synthetic T3 or, in this case, desiccated thyroid extract. Back in the 1980s, when synthetic thyroid hormone was coming into vogue, there was a controversy that raged among endocrinologists about the quality and consistency of desiccated thyroid extract, which had been used exclusively since around 1900 for the treatment of hypothyroidism. And though at that time there could have been validity to those arguments, in modern day treatment of thyroid hormone, the manufacturers have been scrupulous in following FDA guidelines, and those issues regarding quality and consistency are no longer considered valid. NP thyroid is created by the extraction of thyroid hormone from pig thyroid or porcine thyroid, which is very much biochemically similar to human thyroid, though there is a somewhat higher proportion of T3 to T4 in porcine compared to human thyroid. Desiccated thyroid hormone, including NP thyroid, can be used in all forms of treatment for hypothyroidism, such as Hashimoto's, status post-radiation treatment of the head or neck resulting in hypothyroidism, those people who've had thyroidectomies, etc. Because NP thyroid has T3 in it, it is able to balance the ratio of T4 to T3 in the peripheral blood. Potential adverse reactions are very similar, in fact, identical to adverse reactions from any form of thyroid hormone, including levothyroxine or T3 alone. And the most devastating of those adverse reactions would generally can be considered cardiac in nature, the onset of atrial fibrillation, tachyarrhythmia, congestive heart failure, and even the induction of myocardial infarction. However, other adverse events could occur in the central nervous system with excess anxiety, panic attacks, in the gastrointestinal system with diarrhea, and therefore it is advised to avoid over-treatment of an individual with thyroid hormone. It should be noted that NP thyroid is less expensive than other forms of desiccated thyroid extract on the market, and also less expensive than brand levothyroxine. And for many individuals, this is quite important because we're not talking about a time-limited treatment, but many people on thyroid replacement will be on thyroid replacement for their whole lives. So cost is a big issue. So which of your patients could benefit most from desiccated thyroid extract? I think that's really one of the key points we need to address. Well, first of all, there are several studies that point to patient preference for desiccated thyroid extract. The study that you see here is from the NIH, a double-blinded randomized study where individuals were given levothyroxine and alternately desiccated thyroid extract and then reversed. And then patients were evaluated for their preferences and also quality of life on these two different treatments. And what was found, 49% of the population in this group preferred desiccated thyroid extract, 19% preferred levothyroxine alone, and 33% found no difference. One of the criticisms for that study was that there was little difference in the quality of life on the two different treatments. However, the fact that patients had a strong preference for DTE was quite remarkable. Independently of the sponsor of this lecture, my colleagues and I did a similar retrospective study of patients who had been on levothyroxine and desiccated thyroid extract. And briefly to say that out of the 450 patients whose charts we reviewed, 117 of them were showing a strong preference for desiccated thyroid extract in a questionnaire where a patient rated their response as 1 to 5, with 5 being an excellent response and 1 being a poor response. Another study that was done in an endocrine practice found that in those patients who were being treated with desiccated thyroid extract, 92% of them on desiccated thyroid extract responded that they felt excellent or very good or good while undergoing treatment with DTE. So on the slide that you're seeing now is an example of an individual who potentially could benefit by combination therapy. She's a young woman with a family who shows interest in health and nutrition. She has access to the internet and has a great deal of interest in this subject, probably because she has encountered some issues getting a full symptomatic response. She has been treated with levothyroxine for several months. She has been carefully managed by her physician, who's kept track of her thyroid function tests with a goal of getting her TSH into an optimal range. However, despite getting the thyroid functions into a good range, the patient continues to experience issues that are characteristic of a deficiency in thyroid hormone. After further research by the patient, she comes to the office asking about combination therapy. And at that point, she is given combination therapy, is found to have a satisfactory response. However, further evaluation of her thyroid function tests are required to achieve the optimal, what I would call bullseye for her thyroid function test, where the TSH remains in a normal range and the patient achieves euthyroidism without being either under or over treated. A very good quality of NP thyroid is that there are 5 different doses of medication. And if you've been treating thyroid patients for any length of time, you know it's quite tricky to find just the right dose. I like to refer to it as the bullseye that you're trying to achieve. And by having access to 5 different doses, the individual that you're treating has this wide range of options to get the thyroid levels just where you're hoping to get it. Thyroid hormone is not well absorbed from the gut, and for that reason, it is somewhat inconvenient to take thyroid hormone. But in brief, we generally want patients to take the thyroid hormone on an empty stomach with an adequate amount of water and to wait 1 to 2 hours before consuming food or other medications. However, alternately, if that's not going to work, it has been used in a way that for people who are working, for example, that they can take the medication, the NP thyroid, after a meal, but this should be at least 2 hours after consuming food to make sure that the stomach is empty at that time. And finally, here are some resources provided by Acella for you and your patients. On the left is a handout for your office, and on the right is a fact sheet for your patients. And you can access the Acella website or discuss it with your pharmacology representative. So to wrap things up, the indication for use of NP thyroid is the treatment of hypothyroidism. NP thyroid as a natural desiccated thyroid extract is a combination of both T4 and T3. You have an array of dosing so that you can hit the therapeutic bullseye, and the preparation of the product meets the highest standards of quality and consistency, and there should be no further concern, as there may have been at some point decades ago, about this type of medication and its quality control. Here's some important risk information. Indications and important risk information. Indications. NP thyroid is a prescription medicine used to treat a condition called hypothyroidism from any cause, except for cases of temporary hypothyroidism, which is usually associated with an inflammation of the thyroid known as thyroiditis. It is meant to replace or supplement a hormone that is usually made by your thyroid gland. NP thyroid is also used in the treatment and prevention of normal functioning thyroid goiters, such as thyroid nodules, Hashimoto's thyroiditis, multinodular goiter, and in the management of thyroid cancer. Warning: drugs with thyroid hormone activity alone or together with other therapeutic agents have been used for the treatment of obesity. In euthyroid patients, doses within the range of daily hormonal requirements are ineffective for weight reduction. Larger doses may produce serious or even life-threatening manifestations of toxicity, particularly when given in association with sympathomimetic amines, such as those used for their anorectic effects. Important risk information: thyroid hormones, including NP-thyroid, should not be used either alone or in combination with other drugs for the treatment of obesity or weight loss. In patients with some normal thyroid levels, doses of NP-thyroid used daily for hormone replacement are not helpful for weight loss. Larger doses may result in serious or even life-threatening events, especially when used in combination with certain other drugs used to reduce appetite. Indications and important risk information. The therapy of myxedema coma requires simultaneous administration of glucocorticoid. Concomitant use of NP-thyroid with oral anticoagulants alters the sensitivity of oral anticoagulants. Prothrombin time should be closely monitored in thyroid-treated patients on oral anticoagulants. In infants, excessive doses of NP-thyroid may produce craniosynostosis. Partial loss of hair may be experienced by children in the first few months of therapy, but is usually transient. Adverse reactions associated with NP-thyroid therapy are primarily those of hyperthyroidism due to therapeutic overdosage. Many drugs and some laboratory tests may alter the therapeutic response to NP-thyroid. In addition, thyroid hormones and thyroid status have varied effects on the pharmacokinetics and actions of other drugs. Administer at least 4 hours before or after drugs that are known to interfere with absorption. Evaluate the need for dose adjustments when regularly administering within 1 hour of certain foods that may affect absorption. NP-thyroid should not be discontinued during pregnancy, and hypothyroidism diagnosed during pregnancy should be promptly treated. Thank you, everyone, for your attention. I'd like to thank the Endocrine Society for being innovative and allowing us to use the internet as a means of communicating these important messages to you. And I hope that this provided you with some insight that will enable you to better respond to the needs of your patient.